Advanced Health was listed on the JSE in April 2014, owns a number of day clinics in Australia, eMalahleni, Roodepoort and Soweto.
Yes, the guy behind it is a person called Carl Grillenberger, who was in fact involved with a business called PresMed, and he was more or less involved somehow with Life Healthcare as well. Went to Australia, built up some businesses there, came back, and then seeing how well these other listed entities were doing on the market, decided to take Advanced Healthcare Limited, his Daycare Clinic Group, back onto the JSE in that time frame.
Market cap 443 million rand, trades on a PE ratio of around 60.6 and does not yet pay dividends. Your thoughts on this story in the context of the broader health conversation that we've been having?
Well, from a listing perspective, obviously they're the new kids on the block. But what you need to look at in terms of obviously entering a market, there are no barriers to entry. But certainly if the National Health Insurance program goes on, possibly it will impact more on them. Now, if you look in terms of, say, the education sector and the health sector in South Africa, you know, a lot of people are crying in terms of the quality of government provision. You have seen, obviously, say, Curo in the education sector, also very high PE, pretty much similar to Advanced Health. So certainly, I think, you know, it might find it very tough, you know, in terms of to break in and to start paying dividends. I think in these uncertain times, for us, you know, we're looking for stocks that really would pay dividend. But I understand that, you know, they're still growing, and if you're a growth stocks, you don't want to pay dividends until you know that your revenue or income streams are certain.
Talk to us about the performance from a share price
it seems a bit spotty, so that didn't sell itself very hard.
Nothing to write home
but,
about,
you know,
at the moment.
400 million, it's not an insubstantial player. The concept around day clinics is that you don't stay overnight, right? So this is a place you go to for short-term procedures. You're in the morning, out by the evening.
Don't the larger hospital groups have that facility
do that
as
too,
well?
Certainly, they do. So it's all about who who's linked to these facilities. Because, you know, if you're having something done, I don't know what you're having done, but, you know, you go to the person who operates out of the particular theatres and facilities where the stuff happens. So in this day clinic thing, it would again be linked to specific medical practitioners who operate out of those environments.
Anything else to add on this story, Joseph?
So certainly, I think it's a partnership thing that will make them succeed, you know, within that industry. So they need to have a very good, reputable medical practitioners who certainly recommend, you know, patients to go to these clinics and so on. Headlining earnings per share coming down about 48%. Certainly because obviously, you know, they're starting, but I think they might still face a little bit of some headwinds. So we'd love it to, you know, to kind of bed in a little bit and see how it moves from there.
Yeah, it's all about leads and lags in terms of rollouts, new facilities, debt. The Australian thing is still a work in progress. So I think just give it a few years.
Give it a bit of time.
Yeah,
wait and see on
Unless
this
you know
model.
Carl Grillenberger yourself, I would say probably not hot, but maybe if
Not
you
hot,
can get to
Joseph?
him, chat to him, you can see some opportunity.
Hot, not hot, sir?
Not hot.
Double not hot.